Hayologists have a name for what you're experiencing. They call it cellular starvation of the auditory nerve. And once you understand what that phrase actually means, everything changes. 6 weeks from now, you could be sitting in a quiet room, actually quiet. The ringing that has followed you for months, maybe years, softened or gone entirely. Not because of any medication, because you finally gave your auditory nerve what it had been starving for. But right now, you wake up at 3 in the morning and it's already there. That high-pitched whine, or that low hum, or that clicking sound only you can hear. You turn on a fan to drown it out. You sleep with white noise. Here's what most people in your position have never been told. There is one specific mistake that will make everything I show you today completely useless. I'll tell you exactly what it is, but not yet. Because first, you need to understand what is actually happening inside your ear. Today, I want to walk you through 8 specific factors. I call them the 8 silencers that research shows can support the auditory nerve capacity to protect and repair itself. This is not a quick fix. I want to be honest with you about that. But for most people, the first real moments of silence, not complete silence, but noticeable, meaningful quiet, come somewhere between the 3rd and the 6th week of consistent, structured nutrition. Let's start with the one most people are most deficient in, and the one that may be doing the most damage right now. Think of your inner ear as a city at the end of the world's smallest pipeline. The labyrinthine artery, the tiny blood vessel that feeds your cochlea, is so narrow that even minor changes in blood thickness or localized inflammation can cut off oxygen to the hair cells that detect sound. And when those cells are deprived, they don't just stop working, they start misfiring, sending false signals, phantom sounds. Zinc is your inner ear's primary antioxidant defense. Its job is to neutralize free radicals, unstable molecules that attack the hair cells from the inside. When zinc levels drop, those cells are essentially rusting. Oxidative stress builds up, cell walls weaken, and the hair cells begin generating random electrical signals. Your brain hears those random signals, and your brain translates them as sound. The best food sources of zinc for auditory health are oysters, pumpkin seeds, and grass-fed beef. 2 tablespoons of pumpkin seeds daily gives you roughly 1/3 of your recommended zinc intake. Add them to breakfast, scatter them over a salad, or eat them as a snack. If you're considering a supplement, the most absorbable forms are zinc pollinate or zinc bisglycinate. A typical adult dose ranges between 25 and 40 milligrams per day. But discuss this with your doctor because too much zinc can interfere with copper absorption, and that matters. Here's something worth sitting with for a moment. Zinc deficiency is one of the most common nutritional deficiencies in men over 50. 1 in 4 men in that age group is running low, and most have no idea because routine blood panels rarely screen for it. You may have been zinc deficient for years now, the nutrient that may be the most direct cause of the sound you're hearing right now. Your auditory nerve is wrapped in a protective coating called the myelin sheath. Think of it like the plastic insulation around an electrical wire. When that insulation is intact, signals travel cleanly from your ear to your brain. When it deteriorates because of B12 deficiency, the wire is essentially exposed. An exposed wire sparks. It short circuits, and your brain, which is trying to make sense of those erratic electrical signals, interprets them as sound. Here's what makes B12 especially difficult in the context of tinnitus. The normal range on a standard blood test is not the same as the optimal range for nerve regeneration. Many people with significant tinnitus have B12 levels that fall within the laboratory's reference range, but are still too low for the myelin to repair itself effectively. Research published in the Journal of Laryngology and Otology found that B12 supplementation in patients with noise-induced tinnitus led to measurable improvement in symptom severity within 8 to 12 weeks. The most bioavailable form of B12 is methylcobalamin, not cyanocobalamin, which is the cheaper version found in most standard multivitamins. If you can't get your levels tested immediately, a daily sublingual methylcobalamin supplement of 1,000 micrograms is a reasonable starting point for nerve support. Food sources include wild salmon, sardines, beef liver, and eggs. If you eat these regularly and still experience symptoms, absorption may be the issue, not intake. Certain common medications, including metformin and popular acid-blocking drugs, can significantly reduce B12 absorption. If you're currently taking either, that conversation with your doctor is worth having. I want to pause here because I know what some of you are thinking. I've heard about B12 before. I tried it and nothing changed. And I want to say that reaction is completely valid, because the form matters, the dose matters, and most critically, one nutrient alone rarely does the job. This is a system. Each piece supports the others. Which brings me to the nutrient that most people completely overlook when it comes to tinnitus, and the one most likely connected to stress. When you're under stress, and stress here means anything from a loud concert to an argument to a poor night's sleep, your brain releases a neurotransmitter called glutamate. Glutamate is the accelerator pedal of the nervous system, and controlled amounts are essential. In excess, it overstimulates auditory neurons, forcing them to fire continuously. Magnesium is quite literally the brake pedal. It blocks a specific receptor in the brain called the NMDA receptor, which is the primary target of glutamate overload. Without enough magnesium, the auditory system runs at full speed with no brakes. Research from the University of Michigan found that magnesium deficiency significantly amplifies noise-induced hearing damage, and that supplementation reduced tinnitus symptoms in a meaningful percentage of participants in a controlled trial. A quick question, and I'm genuinely curious. Do you notice that the ringing is worse on days when you're more stressed or sleep-deprived? Write yes or no in the comments. The pattern you observe in your own symptoms will tell you a lot about which of these deficiencies is most relevant for you personally. Two excellent dietary sources of magnesium are dark leafy greens like spinach and Swiss chard, and dark chocolate, at least 70% cacao. 1 cup of cooked spinach provides roughly 40% of your daily requirement. If you prefer supplements, look for magnesium glycinate or magnesium threonate. The threonate form has the advantage of crossing the blood-brain barrier more effectively, meaning direct access to those overactive auditory neurons. Standard dose is 300 to 400 milligrams in the evening. Evening is important. Magnesium also significantly improves sleep quality. And sleep, it turns out, is when the auditory nerve does most of its active repair. 4 nutrients down. And now the one most people completely dismiss because they associate it with bones. Vitamin D3 functions more like a hormone than a vitamin. It activates specific receptors throughout the nervous system, including in the auditory pathway, and it directly regulates genes responsible for protecting clear hair cells from oxidative damage. A study published in the Annals of Ototology, Rhinology, and Laryngology found that patients with chronic tinnitus had significantly lower D3 levels compared to control groups. And in a follow-up intervention study, supplementation brought meaningful improvement to tinnitus severity in participants who started with deficient or insufficient levels. The mechanism appears to be twofold. D3 reduces systemic inflammation, which improves blood flow through that tiny labyrinthine artery, and it directly modulates the calcium channels and hair cells that are involved in generating phantom sounds. Vitamin D3 from food alone is genuinely difficult to achieve. Fatty fish, especially wild salmon and sardines, are the best sources, but even eating them 3 times a week rarely reaches therapeutic levels. Most researchers working in this area recommend a daily D3 supplement of between 2,000 and 5,000 IU, taken with a fat-containing meal, since D3 is fat-soluble. And critically, take it alongside vitamin K2. K2 directs calcium to where it belongs in the body, and prevents it from depositing in places it shouldn't. D3 and K2 together is one of those nutritional partnerships that multiplies the effect of each individual component, like zinc and copper, like magnesium and B6. This is the pattern, not individual nutrients in isolation, but a coordinated protocol where each element makes the others work better. Now, the fifth element, the one that works at the cellular level most people never consider. The cell membranes of your cochlea hair cells are composed largely of omega-3 fatty acids, specifically DHA, docosaic acid. When your diet is chronically low in omega-3s, those membranes become rigid, less fluid, less responsive to the microscopic vibrations that represent sound. But there's a second mechanism even more directly relevant to tinnitus. Omega-3s significantly reduce blood viscosity. They make the blood more fluid. And remember that labyrinthine artery, the microscopic vessel feeding the cochlea? Even a small reduction in blood thickness can meaningfully improve oxygen delivery to hair cells that may have been struggling for years. A meta-analysis of 7 clinical trials found that regular omega-3 consumption was associated with a 31% reduction in age-related hearing decline in men over 50. While caught fatty fish, salmon, mackerel, sardines, herring, are the most bioavailable sources of DHA and EPA, 2 to 3 servings per week, baked or grilled, not fried. If you supplement, look for a product that specifies at least 1,000 milligrams of combined DHA and EPA per serving. Algae oil is worth considering. It skips the fish entirely and goes directly to the original source. The DHA in fish comes from algae they consume. Algae oil gives you the same compound at the starting point. Take omega-3 with food. Refrigerate the bottle after opening and be consistent. Now, I promise you something important, the one mistake that breaks the whole system. We're almost there. But first, 2 factors that most directly accelerate auditory nerve damage. One of them is almost certainly in your kitchen, and one is almost certainly in your medicine cabinet. 2 substances block zinc absorption at a fundamental level, caffeine and phytates. Caffeine increases zinc excretion through the kidneys. 2 to 3 cups of coffee per day can reduce zinc absorption by as much as 30 to 40%. This doesn't mean you need to give up coffee. It means the timing matters. Phytates are naturally occurring compounds in processed grains, in many cereals. They bind to zinc in the digestive tract and carry it out of the body before it can be absorbed. Many people who are doing everything right nutritionally are simultaneously blocking the absorption of the mineral their auditory system needs most. The fix is straightforward. Separate your zinc-rich foods or zinc supplements from your morning coffee by at least 90 minutes. If you eat oats daily, soaking them overnight significantly reduces their phytate content. And take your zinc supplement in the evening with food, not in the morning. Now, the medicine cabinet. Certain common medications are classified as ototoxic, meaning they can chemically damage the hair cells of the inner ear. The most widely consumed otoxic substance is aspirin. At regular doses used for pain management, not an occasional tablet but consistent daily use, aspirin has been shown to reduce cochlear blood flow and damage the outer hair cells. This effect is dose-dependent and in many cases reversible if identified early. But for someone taking aspirin daily, the cumulative effect over months and years is genuinely worth a direct conversation with your physician. Other potentially otoxic medications include ibuprofen at high doses, certain diuretics, and some classes of antibiotics. This is not a reason to stop any prescribed medication. It is a reason to have one very specific conversation. Ask your doctor, are any of the medications I'm currently taking known to affect hearing or tinnitus? Write that down if you need to. It's a direct question, and the answer may open options you didn't know existed. Of course, never change or stop a prescribed medication without your doctor's guidance first. Now, stop. Before you move forward, I need to tell you something I held back. For approximately half of you watching right now, following everything I've described will produce noticeable results within 4 to 6 weeks. A reduction in intensity, longer periods of quiet, moments where you realize you haven't heard it for the past hour. But for the other half, nothing will change. Not because the nutrients don't work, but because of a sequencing error that erases the benefit before it can accumulate. Here is the mistake: starting everything at once. When you introduce multiple new supplements simultaneously, some combinations actively compete for absorption: zinc and copper, iron and zinc, calcium and magnesium. If you take them all together at the same time without structure, you get a fraction of the benefit you would otherwise receive. Here is the protocol that actually works. Weeks 1 and 2, zinc and magnesium only. Let your baseline absorption pathways stabilize before adding anything else. Weeks 3 and 4, add B12 and D3. Your zinc levels are now sufficient to support the enzymatic processes that make B12 conversion more efficient. Week 5 onward, add omega-3. At this stage, your cell membranes are ready to integrate DHA effectively. And throughout, separate everything from caffeine by at least 90 minutes. Now, the open loop from the beginning of this video, the nuance I said would make everything fail. It's consistency. Not the protocol itself, not the specific supplements. The thing that causes this approach to fail for most people is stopping after 2 weeks because they haven't noticed a dramatic shift yet. The auditory nerve regenerates slowly. The myelin sheath, once it starts rebuilding, takes time. The coya hair cells don't transform overnight. The research consistently shows that the first real changes in tinnitus severity begin between weeks 3 and 6. That window, weeks 1 through 3, is where most people quit. Don't quit in the gap between starting and seeing results. The gap is where the repair is happening. Let me give you something concrete before we finish. A single meal that delivers all 5 core nutrients together. I call it the rescue dinner. Start with wild salmon, baked, not fried, around 150 grams. That covers your omega-3, your D3, and a significant portion of your B12 for the day. Serve it on fresh spinach, dressed with olive oil and lemon juice. The spinach delivers magnesium. The olive oil provides the fat needed for D3 absorption. Scatter 2 tablespoons of raw pumpkin seeds on top. There's your zinc. Finish with freshly grated ginger, not powdered, fresh. Ginger contains compounds called gingerols and shogols that have been shown in studies to support microirculation, blood flow through small vessels, potentially including the labyrinthine artery itself. 1 meal, 5 nutrients, 30 minutes to prepare. Here's what I want you to do after this. First, request the B12 and D3 blood test at your next routine appointment. Ask your doctor to include them. Knowing where you actually stand changes the entire approach. Second, start with zinc and magnesium this week. Not next Monday, this week. Third, and this is the one I really want you to do, come back next week because I'm going to go deep on how to read your B12 blood test, specifically the difference between the normal reference range and the optimal range for nerve regeneration. That distinction alone may explain why nothing has worked for you before. One more thing. Do you know your current vitamin D3 level? If you've had it tested recently, drop your number in the comments. I'm genuinely curious how many of you watching are in the deficient range. Based on the research, I'd estimate more than half. If today was useful, a like helps this reach other people who have been told there's nothing they can do about their tinnitus. There is something. They deserve to know it. Take care of your hearing, and I'll see you in the next.